Living a low-stress, positive life is something that everyone wants to achieve. In saying this, living in the world that we do, sometimes it seems hard to fulfill. The study was aimed to develop a deeper meaning and understanding of this topic. We did a study with 15 participants. It was 60% female and 40% male, and it was for a duration of 10 days. The participants were directed to think of something positive or something to look forward to in the morning, at lunchtime, and at dusk every single day, and then they were told to take the perceived stress scale right before they went to bed. The results showed that doing this, thinking of something positive, did reduce stress levels throughout their day and throughout the study overall.
Every person is very different, but we all have one thing in common, and that's stress and wanting to find a way to cope with it in a healthy manner. Stress is your body's response to challenges throughout your daily lives. And in our study, we had the hypothesis that if test subjects were to participate in positive thinking 3 times a day, then their stress levels will be reduced.
There is a bunch of present literature that focuses on varying forms of optimism as a successful intervention in stress reduction, as well as a tool for improving well-being and happiness. I'm going to briefly discuss a study that examined the effectiveness of optimism on stress. So, Dugal et al. 2001 examined the effects of optimism following a traumatically stressful event. The participants included 159 rescue and recovery workers from the crash site of the U.S. Air Flight 427 approximately 2, 6, 9, and 12 months after the crash. The results concluded that, as predicted, a more optimistic disposition was associated with less self-reported stress. Essentially, what this means is that practicing optimism as a coping strategy for stress, in this case traumatic stress, can be successful in reducing that amount of stress. To give a brief overview of the methods, the present study was interested in whether optimism reduces stress. In order to test this, participants were instructed to think of something positive or hope for something positive during their day for approximately 1 to 2 minutes. Subjects were instructed to do this 3 times a day, in the morning after waking up, midday, and in the evening right around dusk or dinner. In order to measure stress, participants completed the Perceived Stress Scale, also referred to as PSS, developed by Cohen et al. In 1983. The participants were instructed to complete the Perceived Stress Scale each day around bedtime prior to falling asleep. The overall study spanned of a total of 10 days and with 15 participants. The Perceived Stress Scale, PSS, consists of 10 items ranging on a 4-point Likert scale from 0, which is never, to 4, very often. Individual scores on the PSS can range from 0 to 40, with higher scores indicating higher perceived stress.
11 out of 15 subjects had an overall reduction in stress. Looking at the average, the sample decreased in stress by 0.21 points per day, with a strong 0.86 correlation rate. Women were equally strong with a reduction of 0.24 points per day and a correlation rate of 0.85. The males had a lower rate of 0.16 per day and a correlation rate of 0.76. It should be noted that there was 3 less males than females and that their average stress was about 5 points less than females.
In the beginning, we hypothesized that positive thinking would reduce stress among individuals, and our findings were consistent with this hypothesis. Our findings were also consistent with prior studies done on positive thinking. If this study was done in the future, it may be beneficial to monitor stress levels less often than done in this study to help with participant consistency. In conclusion, positive thinking is a great method to help the mind and the body in terms of health.